So what is FSH? Gonal-F and Follistim are the two pens that you'll use that are the synthetic FSH. You naturally have FSH in your body. It's a follicle stimulating hormone. We're giving you more FSH via Gonal-F or Follistim to produce hopefully more follicles. And so we're just enhancing the production of FSH in your body. How many days will you be on Gonal-F or Follistim? Typically, this lasts from the beginning to the end of your IVF cycle, so anywhere from 8 to 12 days, aside from the day of your trigger. Sometimes on the day of trigger, they have you take your other medications as well, but typically it's just the 8 to 12 days of the Gonal-F or Follistim, and that may be in conjunction with your other medications. Gonal-F or Follistim are both administered subcutaneously, meaning in the fatty tissue via, it's an injection. So all of these medications are injectable unless otherwise noted. You will be injecting them in the fatty tissue. We usually recommend using the fatty tissue in your abdomen. Some patients do use their upper outer thigh as well. But the abdomen is the most commonly recommended spot to inject subcutaneously. Side effects of Gonal-F or Follistim can include bloating, foggy headedness, headache, nausea. These are the most common symptoms overall with the IVF medications. Again, in conjunction with other medications, it can definitely increase your likelihood to have these side effects, but overall it's the bloating and the headache and the foggy headedness that we hear from patients. Is there a difference between Gonal-F and Follistim? No, they're just different brand names of the same medication. They are both FSH, synthetic FSH, and they are exactly the same, just different brand names. One of the most helpful things that we do via our virtual care services and our live injection walkthroughs is showing you how to mix your medication. So medications like Menopur, for example, it is the most commonly used medication during the IVF process. It requires you to mix the medication yourself. And a lot of people have trouble making sure that they're doing this correctly, they're using the right amount of diluent, and that they're getting the right dose. And so one of the most helpful things that we do is actually walk you through this virtually. We can guide you on exactly what to do, even though we're not physically there with you. A lot of patients find this very helpful.